So let us see some case presentations. As mentioned, the first patient I seen was with a 18-year-old female with seizures, post-ictal confusion was there, elevated renal parameters. She had to undergo dialysis to get better. EEG was abnormal. She had showed epileptiform discharges in the EEG. Other parameters were SLE was positive. She was treated with anti-epileptic drugs, dialysis, and improved and discharged. So, seizures can occur in 42% of the patients, and in almost 27% can be an early manifestation, and in 10% are the presenting symptom of SLE, like this girl I have mentioned. And why do these seizures occur? Because there can be cerebral vasculitis, which can be ischemic or hemorrhagic. It can be cardioembolic, opportunistic infections may be present, drug intoxications, metabolic derangements apart from medication effects like steroids. And treatment will be, you have to treat with anti-seizure drugs or anti-epileptic drugs and treat also the SLE. The second case which we are going to discuss is now a headache. This is a 41-year-old woman, and here is usually you find that SLE is much more common in women than in men. And this is a 41-year-old lady with a known SLE. She presented with headache and mild cognitive impairments, but there was no motor deficits. And when we did the MRI, because of the cognitive involvement, she showed that there is ischemia in the periventricular white matter region. And this is because of the occlusion of deep penetrating branches from local branches, which are involved because of the local vasculopathy. This is a very focal involvement. She had no clinical or lab evidence of lupus anticoagulant or anticardiolipid antibody. And there are others, and she had presented only with a migrainous headache. Migrainous headache can produce some white matter involvement in different parts of the brain, and as you can see, you got multiple white matter abnormalities in this patient. Organic encephalopathies like she had presented can present as organic encephalopathies in 35 to 75% of the patient. She had presented with an acute confusional state. They can be acute, subacute or chronic, can present as acute confusion, lethargy or as coma. When it presents in a chronic or subacute fashion, it is usually manifest as dementia. Acute or subacute mental state changes may be secondary to the diffuse cerebritis which is seen, or because of multiple focal lesions also. Psychiatric symptoms also may occur, and this could be in the form of depression, mania, psychosis.